Hey there. So somebody sent me a private message and asked me specifically about hip pain and if I could do a video on that because I'm assuming they were having hip pain. One of the challenges in my job of somebody coming in and saying, I have hip pain, I always say take one finger and point to me where the pain is. One of the things that I've learned over years of practice, 30 of them, okay, can't believe I admitted that online, but anyway, after all these years of practice, one of the things that I've seen is how many different places a hip can be in different people's cultural experiences and pain experiences. Sometimes their hip is here. Sometimes their hip is here, which is where it actually anatomically is. Sometimes it's out here, which is a bump on the opposite side of the hip joint. And then sometimes it's clear back here where the sacroiliac joint is. So without doing an evaluation, it makes it very difficult for me to say this is the exact thing you need to do. So I'm going to do several videos and you can try them out and see if it helps your hip pain and or low back pain, because the hip, the pelvis, and the sacroiliac joint as well as the low back are very connected. And because they're so connected, some movements will help all three of those areas, and some movements won't help any of them. So let's get started on doing a couple of movements to see if those will help you. And I'm going to do, again, several videos on this topic to see if I can help hip pain. The other thing is I do evaluations, and I can do evaluations online by watching you move through Zoom connection, or yeah, pretty much I use Zoom. And looking at the way you move and kind of some of your habits that I can see as you're at home. One of the things that we are doing right now is doing a lot of work out of dining chairs and possibly less than ideal work task chairs. And because of that, we all might be getting some hip, some SI joint, and some low back pain. So one of my favorite things to do is just roll my pelvis back. So I'm tightening up my abdominal muscles like I'm pushing my belly button back through my spine, tightening that up, and I get a stretch back here. Then I'm going to push my spine forward through my belly button. And then I'm going to push my belly button back through my spine, and then pull my spine forward through my belly button. I can do it in a smaller movement. I can do it in as big of a movement as I can. And in both of those directions, I'm getting a different sensation in my back. So I want to find what's comfortable. The other thing I can do is decide, do I feel better and more comfortable going backwards? Or from this middle neutral position, do I feel more comfortable going forward? Actually, for me, right now at this moment in time, I feel a little bit more comfortable going backwards. So I'm going to repeat the backwards movement. I usually do it about 3 sets of 10. At the end of each set, I take a little break. I stand up and I shake a little bit, and then I repeat it. What I'm doing is I'm allowing my best muscles and the movements that feel the best to help loosen up the ones that are tighter. So we're going to assume for the sake of this video that that was 3 sets of 10 that I went back. Now I'm going to test going forward again. And notice, do I go any further? Does it feel any more comfortable? Is it any smoother? You can also do this side to side. So shifting one side. So this side is off the chair. It's all crunched up here. It's open here. Then I'm going to switch sides and crunch up here and open there. I can also treat that, for me right now, this side is not as comfortable as when I go to this side. So I'm going to do my comfortable side, 3 sets of 10. And between each set of those 10, I'm going to stand up, move around, shift my weight. Then I'm going to come back and test my hard side. I'm going to decide which one of those movements, or is that movement is doing the easier side helping my hard side get easier? Is doing my easy side helping the pain that I'm having get less? Check it out, test it out, ask yourself these questions. Tomorrow we'll have more movements so that you can test those. You can also call me at 214-225-8530. I don't remember my own number that much. And I can do a 30-minute consultation with you. We can just schedule it. So have a great day and be well.